Honestly.
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 Honestly?
Honestly.
It's that easy to have honest conversations about love,
Sex and relationships.
With the young people in your life.
At Honestly Youth Sexual Health, we are building a movement to improve sexual health outcomes for youth.
Our movement is for everyone.
Because it will take all of us working together
To change the culture surrounding youth sexual health.
where every young person has the resources,
Education, support,
and information to plan their futures and make informed decisions.
about their health.
But why is this so important?
Oklahoma has the 4th highest teen birth rate in the nation.
And Oklahoma County has the highest number of teen birth rates in the state.
Our movement is growing larger and faster than ever before.
and we hope that you will join us. Lately, we've been focusing on innovation and caregivers, especially through our project, Spark Innovation OKC. Our vision for this project is to create a culture where the norm is for caregivers to have open and honest conversations about sexual health with the youth in their lives. Honestly, and our project partners are developing innovative, equitable, and sustainable programs that support caregivers in having these life-changing conversations.
Our understanding of sexual health is always growing and changing, and we wanted to bring innovative new ideas to life within our community. We needed to create spaces to experiment, where we were willing to fail and pivot when things didn't work, and we have to allow the problems to be fully explored, while keeping the communities the projects aim to support at the center of our work through the entire process. We see the need for innovation because Oklahoma has been consistently in the top 5 for the teen birth rate, and we want to bring new ideas to the table to support youth and caregivers in our community.
We lead a huge collaborative effort with many of our partners supporting the community through direct service work within the schools, healthcare settings, and more. Their contribution to our movement is critical to the success we have been able to achieve. When creating Spark Innovation OKC, we looked for gaps in services and resources in our community and eventually realized caregivers would be the perfect focus for this project. I know caregivers can mean a lot of different things, which is why we like it. Data shows caregivers increase the protective factors in young people's lives, but it also shows the caregivers often never receive sexual health education themselves. They don't know where to go to find support for having conversations about love, sex, and relationships with young people. This is where Spark Innovation OKC comes in.
Human-centered design is a unique approach to solving complex problems. With human-centered design, a challenge is identified, but instead of coming to the table with solutions, significant time and attention are given to understanding the end user, what the challenge looks like, and how it impacts them and their life. During human-centered design, we let the end user guide our process, give constant feedback, and shape every aspect of the end result. We brought in innovation coaches from the community to lead this process, challenge the status quo, and take our cohorts through a process that helped them lean into their communities authentically and see the caregivers as experts in their own lives.
During this process, we wanted to build a network. One way we accomplished this was through our network core, which consisted of amazing community organizations like Lilyfield, Sunbeam, OCCHD, and Variety Care. They gave their expertise to our projects from both the sexual health and the nonprofit lens, and served as a valuable resource and guide to our cohorts. The network core would provide feedback on projects, help review budgets and work plans, and be an overall resource to anyone involved in the project. This core group of partners helped strengthen our program network and furthered the breaking down of silos that can happen to organizations working in the same community.
Our Context Expert Advisory Committee is a group made of local caregivers who met monthly to ensure projects are culturally responsive, relevant to the community, and appropriate for caregivers. This committee serves a crucial role in helping select the organizations that are most appropriate and equipped to serve their communities. Helping those organizations to make changes to their projects makes them more relevant and effective for caregivers.
Spark Innovation OKC spent 3 years working with 12 organizations split between 2 cohorts. In the first 2 years, our cohorts worked through the human-centered design process and participated in sexual health trainings before building out their projects. Those projects would then go through a process of being tested and refined, obtaining feedback and pivoting to better meet the needs of the caregivers they worked with. By the third year of this project, we were doing additional testing and even launching replications of these projects by bringing in additional organizations as partners.
Through Spark Innovation OKC, Honestly has been able to assist in the distribution of information, tools, and trainings to over 7,000 people in Oklahoma County. Throughout the Spark Innovation Grant, Honestly provided more than 15 training opportunities to cohorts and community groups. Across 48 training implementations, Spark Innovation OKC projects reached 4,406 community members, including 1,812 caregivers and 887 youth.
Honestly, Youth Sexual Health
Envisions a community that embodies
The idea that sex education is for everyone.
We know from our research and experts right here in our community
That conversations about sexual health should not be limited by age.
That means programs and systems designed to support youth, college students, and adults.
Adults need this education so they can pass down accurate
and affirming information to young people.
Not to mention, sexuality is something you can never fully learn.
Because information and resources needed change as we get older.
Rather than perpetuating fear and shame, we see a future where
Honest information is the expectation.
If we start there, we can build spaces for discovery and innovation.